Did you know that? Yeah, buddy.
All right. Good morning, everybody. 9:02 on Wednesday morning, March 16th. We're going to call the meeting of the Public Health Committee to order. I am not Jared Sanchez. I am Anita Lewis. I made Jared go on vacation just so I could take over the big chair today. So if we could do a call to order.
Lewis,
Here.
Shepro, Strathman,
Strathman here.
Tepe,
Trepro's here, uncharacteristically muted.
We can only hope. We can only hope.
Wallace, Silva,
So is here.
Sanchez. You have a quorum.
Okay, thank you. I'm going to need a motion and a second for the approval of the minutes from February 16th.
So moved. Tepe.
Tepe and Strathman second. Any questions or comments? Seeing none, call the roll, please.
Lewis,
Yes.
Shepro,
Trepro, yes.
Strathman,
Strathman, yes.
Tepe,
Tepe, yes.
Silva.
Silva, yes. Silva, yes.
Thank you.
Thank you. All right. The finance budget reports are attached. Any questions or anybody need to raise anything on that? Okay, seeing nothing. I don't have any notes about public comments. Okay, now on to what we all want to hear about. Tell us COVID's over and we're all healthy because it's sunny out.
Well, I don't know about that, but we're living with it, right?
We are.
So our very first item is a presentation about mass vaccination recap. And I'm sorry, I'm Kathy Fosser, the interim executive director. I asked a small team from our department to assemble a presentation for you all today about King County Health Department's emergency response regarding the COVID-19 vaccination implementation mitigation strategy. Ooh, that's a hand. So I think it was important for us to look back at where we were and, where we are now. This layered mitigation strategy, like others such as contact tracing and case investigations, is very labor intensive. But it was so very critical. All the joint efforts of support and hard work was essential, displayed by the King County Board, King County Health Department employees, MRC volunteers, various King County departments, and most importantly, 2 community partners. While this presentation today represents a community coming together, I want to thank my hardworking King County Health Department teammates, as you truly were and continue to be the backbone support to make the vaccination efforts thrive during very challenging and stressful moments. So without further delay, Erin, Katie, Laura, and Teresa will now take us on a quick trip down memory lane of our COVID-19 vaccination distribution throughout King County.
Yes, thank you, Kathy, for that warm introduction. And also thank you, Kathy, for inviting us here today, and board members, Public Health Committee, esteemed colleagues. We are very excited about this. We are very grateful for the opportunity to come and.
Excuse me, would you state your name first, please?
It is Aaron Stevens. I'm the emergency response supervisor.
Thank you, Aaron.
Got it. So I'm very excited to be here today, as the other presenters are. And like Kathy said, we're the ones presenting here today, but this is representative of a lot of people, a lot of agencies, a lot of work that went into this. Truly blood, sweat, and tears, all 3 of these went into this. The KCHD staff, early morning vaccine transfers, nonstop vaccine drawing, wonderful nurses, wonderful staff that did translation at the sites, have put in countless hours, been working overtime for 2 years straight. And loved it all, and they never wanted to give up. We had hardly any turnover during that entire time, and everybody's kept the same spirit, which is this is what we're called to do, and we're pleased to be able to do it and serve this community. So this really is dedicated to them. So we'll dig right in. So we want to keep this relatively brief because it's a lot that happened, but we want to make it digestible for you all. So we broke this into 3 segments. We've got the planning phase, which ran from approximately August of 2020 through December of 2020, although planning, of course, went through the entire effort. The second would be the response phase and the summary and dedications. So we do want to make sure that we acknowledge all of our partners again. So we'll be doing that. And also, there will probably be things that you're wanting to question or have comments about, and we would just ask if we could just hold questions till the very end. We will open the floor up at the end to have dialogue. All right, so starting out here, going into this, we knew there were going to be a couple of main factors in play that we had to use in our planning. And just to briefly summarize these without reading verbatim, we knew that the distribution of vaccination in large volumes was going to require numerous agency support. So one of the first things we did was we got on the phone and we started having coordination meetings. We thought about how many partners we needed to be in communication with early, because we didn't want to be knocking on their doors the day before we opened up. So we started reaching out 6 months prior to even receiving the vaccine, while we were still heavy in the response of COVID itself, with the testing, PPE distribution, contact tracing, and many other things. If you remember, it was obviously a short time ago, but this was unprecedented, the way that it was expedited and how short of a time duration it was before the vaccine actually hit our doorsteps. So it was literally in the middle of an ongoing massive response that was already unprecedented. So we wanted to get everyone involved early as possible, because of course, many of our healthcare partners were dealing with their own issues. New federal and state assistance was going to be a big part of this. Tier distribution using priority target groups. Going back to H1N1 and other incidents, we know that the CDC is going to say with limited quantities, not everyone is going to be able to receive this from the very beginning, and we will have to use target priority groups. So we wanted to start reaching out and figuring how we were going to organize that, which was a large effort. And then points of dispensing. So of course, we're talking about a mass vaccination site or mass vaccination sites, but just a little brief context here. For basically the last 20 years, if not longer, the CDC has required local health departments to do something called planning for points of dispensing, or pods, or closed points of dispensing. We are required by federal mandates, federal funding that we receive to support everything that we do, to have agreements in place with large venues throughout the facility or throughout the county, and also agreements with multiple nursing homes and entities that have the ability to distribute the vaccine themselves. So what we were doing is making sure that we had a large diversity of venues to be able to distribute the vaccine through. That's what we initially started off with our main focus, because that was the requirement. That has been the requirement for 20 years. It's really only been since COVID that all changed, that the federal government said, we need true large venues, we need united centers and large arenas to bring through the amount of people that are going to want this vaccine. That all happened during COVID. So priority groups, we've already spoken about that. And then we also knew that online registration, electronic registration, was going to be paramount to this, with the surge of people that wanted the vaccine. So going back to H1N1, they weren't as fortunate to have a lot of the technology that was available to us during COVID. And there were stories of large amounts of people being turned away at clinics because the vaccine ran out, and it was a first come, first served basis. Now that's just how it was done. There was nothing else that really went into that. But this was going to require everyone to register before they got there, or else we would be turning literally thousands of people away at the door. So the adoption of online management systems and capabilities changed our efficiency tremendously. Okay, we're going to jump into looking at the mass vaccination plan, and I'll hand this over to Katie Griffiths.
Thanks, Aaron. So beginning with August, this is August of 2020 that we're looking at right
Could
now.
you please tell us your name too?
Yes, I'm sorry.
Thank you.
Katie Griffiths, Emergency Response Coordinator.
Thank you, Katie.
Thank you. So in August of 2020, we finalized the mass vaccination plan. So August of 2020, approximately 6 months before the vaccine rollout, the plan was finalized. On the screen, you'll see the main parts of the plan. We had the public information planning, resource planning, point of dispensing planning, and training, right? Because it's not only about the point of dispensing, it's about the training that goes into it, everything it takes to support all of the sites, and obviously the advertisement of the sites for the general public. Aaron?
All right, so just to look at the high-level objectives that were established in the mass vaccination planning process, again, back in August through October, we knew we had to somehow organize what was going to become literally thousands of activities that had to be executed in a very short time frame by a lot of people involved. So what those really boiled down to was prepare for KCHD to administer vaccines, and at the same time, because we cannot do this alone, prepare medical providers to administer vaccines. And you would think that medical providers, having been used to being in the medical practice and having medical practices in hospitals, would be basically like flipping a light switch for them to start holding mass vaccination clinics. But the truth is that people don't really go to the hospital to get vaccines. They might take their child to a pediatrician, and you might go to get your flu vaccine from your primary care provider, but nothing like this. So the storage requirements they needed help with. The ability to plan for large surges of people and large demand, they needed assistance with. The Illinois Department of Public Health very early on, and to their credit, because it was the best decision, decided that local health departments had to be the main coordination entities for distributing the vaccine within their counties. They just decided that they could not do that because the local county officials, the local county health department are aware of their partners. They know their partners' capabilities. They know who's there, and we interface with them the most. So all of the interfacing, all of the coordination for deciding who gets how much vaccine and what their abilities to distribute that, and all the technical requirements to go into that, all fell on the county health department at the same time as we were preparing to hold our own mass vaccination clinic. So these were two very, very large tasks that were placed on us simultaneously. Build vaccination capacity. So that really boils down to venues and people. So bring in as many hands as you possibly can and look at where you're going to be strategically setting up mass vaccination sites. And then, of course, distributing the vaccine, the training that goes into that, the cold chain requirements, which Laura will speak to a little bit later. But this really all boiled down to a lot of work that I've represented here in what's called the work breakdown structure. So if you're familiar with project management standards, this is something that you'll see in that. I didn't put this up there for you to be able to read. We have all this information available that we'll gladly share with you, but this is just a quick visual representation of what this all boiled down to. And so really what it came down to was public information, resource planning, resource and equipment planning and procurement, closed pod partnering, which means, again, partnering with all of the entities that can distribute the vaccine themselves, because you need this going out the door as fast as possible. So that means your congregate care facilities, jails, nursing homes, and all of those types of entities where you have people already in the facility and you have medical care practice staff there that can administer that vaccine. So getting agreements in place and preparing them to receive the vaccine. And then, of course, training, a never foreseen amount of training that had to be developed that was literally just in time, which is a term we use for training people the day that they come to a clinic, that Teresa Knopf and Laura Barrett were largely heading up with our Medical Reserve Corps and others. And I just, again, put this up for a quick visual representation of how we as the health departments and some of our partners organize. This is what's called the Incident Command System. This is an organizational chart. So in the National Incident Management System, which is something that FEMA administers at the federal level, this is how you organize staff when it comes to an emergency response. So essentially you have a lot of people with regular day-to-day duties, and then how do you flip that over so that now they're plugged into an emergency response effort? And this is how we organize this. And this was set up way back in March of 2020, before actually January of 2020, before we even had the first case here. We had to activate incident command system, the King County Health Department Incident Command System, and I believe it was January 19th, and began holding daily operational briefings along with partners from other health departments, the city of Chicago, IDPH, and many others to prepare. So this was in the works for a long time before the vaccine hit our doors. All right, I'll turn this back over to Katie.
Thank you. So picking right up where he left off, talking about training. So in September of 2020, we were told that the initial planning assumption was to be ready to administer the vaccine by October 1. We know that this was not what ended up happening, but this was the planning assumption that we were working under. So during September, we were heavy underway, organizing with all of our partner organizations and getting ready to be that sole distributor in the beginning. Initially, Operation Warp Speed had not been initiated yet. And so if anyone's unfamiliar, Operation Warp Speed is what allowed the pharmacies to go into all of the long-term care facilities and the skilled nursing facilities and administer those vaccines to that highly vulnerable population as their own private entities. So meaning we were not the ones in the nursing homes, which allowed us to focus on the public, which allowed us to stand up the mass vaccination sites in a quicker time frame. So in September, we didn't know this yet. We thought that we were still going to be in control of the vaccine as far as distributing it to all of our long-term care facilities. So we made contact with over 70 of those healthcare facilities to identify them as close points of dispensing. And when we're talking about identifying these facilities as close points of dispensing, we're talking about staff counts. At that point, they had not, IDPH had not adopted anything from CDC and ACIP yet stating who had priority to the vaccine. So we were following previously written plans where under the assumption is you look at staff counts, you look at family counts of the individuals who work there, you look at the individuals who live there. So we were collecting all of these figures. We were also looking at the capabilities and the equipment that these facilities had. Could we hand them the vaccine and then take it from there? Would it require more hands-on from us actually being on site, doing training and helping with the actual administration? So this took up a large portion of September, but in the meantime, we're still going out and surveying all of those large sites to find and identify ones that would work throughout the county that would be accessible to everybody in the county once we started the mass vaccination sites. Additionally, we were coordinating with our EMS systems throughout the county. There was an expanded scope of practice signed by IDPH, which would allow our paramedics and our EMTs to administer the vaccine. So we began working closely with our EMS systems, who would then write the training plans, which would be approved by the state. And then they would put all of the paramedics and EMTs through this training to allow them to administer, which they became some of our main hands in early mass vaccination sites. Moving on to October of 2020, we are still training. We did receive word that Operation Warp Speed had been initiated at this point. And so we were again contacting all of those healthcare facilities, but this time what we were doing was we were enrolling them. So the CDC reached out and gave them the options. These are the pharmacies that you can choose to work with. But we went through and we called every single one of our long-term care facility and our skilled nursing facilities, and we verified their choices as to who they wanted to partner with. And then we sent that back up to the state so that they could send it to the CDC, and King County had 100% uptake rate of every facility that was eligible, did enroll with a private pharmacy, and were among the first facilities to receive vaccine in King County. In October, we were also doing hands-on training, preparing for mass vaccination. Early on for mass vaccination, one of the key themes brought up was drive-through clinics. This was an idea because the families would stay in the car, it would maintain social distancing. So plans heavily focused on this in the beginning. As we know, this is not the route that King County took, but we wanted to prepare for it. So what you're seeing on the screen is actually pictures that the King County Health Department, in partnership with the King County Office of Emergency Management and the Medical Reserve Corps, held a drive-through flu clinic at the health department to practice how we would actually administer to these cars, to time it. How long does it take for a car to get from this point to this point and for you to actually administer your vaccine, right? Because that's going to tell us how many hands we need and what our throughput's going to be in our 9-hour operational period, which is what our clinics generally ran for. Also in October, we launched the public registration for updates on vaccine timelines. So everyone knew the vaccine was coming. Everyone was eager to receive it. We were being inundated with calls and emails. So this allowed the public to go online to canehealth.com and register themselves to receive the information. This was not a registration for the vaccine. It was a registration to receive information on when they would become eligible for the vaccine. However, when the vaccine did actually launch, we did take all of those emails and they answered a brief survey when they signed up for that information, which then told us which priority group that they were going to fall into. So as soon as we had our priority groups by CDC and ACIP and IDPH adopted, the vaccine came out, we now had a contact list, which we could then send the registration information directly to these individuals, letting them know that they now met priority group, that they could register and they could easily seek the vaccine.
And this is Laura Barrett. Just back in October, just as a point with that is an important piece that happened during that month and was very critical to the success of the mass vaccination clinics was securing resources such as refrigerators, freezers, the transport coolers, which was on one of the pictures on up there, the portable transport coolers. We did a phenomenal job with our resource team in the section, but also with our finance team, Cannell Snowden and his team, and making sure that those were secured quickly because everyone in the world was going after those products to get those because everyone needed it. And we had them here and ready to go. So kudos to that team.
Hello, I'm Teresa Knopf, Assistant Director for Disease Prevention. And in November 2020, we continued to prepare for the shipment of the vaccines. We set up some rapid antigen outbreak test sites. And this allowed us to find out who was positive for COVID and get them isolated very quickly. So the rapid test takes about 15 minutes. We were able to isolate those positive cases and help prevent the spread of COVID.
Thank you, Teresa. And just to go back one here. So something to point out, and I know that it's kind of been brought up that we were receiving a mass amount of calls and emails, but it's really hard to explain what that was like, because it was almost like being in war. We were getting so many phone calls and emails that it was causing such an amount of anxiety. You could not function. It almost got to the point where we weren't able to do our jobs because of the inundation that happened. So of course it didn't last long, and we knew there were other things that had to take place, like farming that out, putting in structures, call centers, which we did quickly. But just to kind of emphasize the demand, at one point I sat down with some of my staff because it was getting to the breaking point with phone calls ringing, with phones ringing off the hook and emails, and also the objectives that had to be carried out. And I said, imagine you are in the United Center and you're at the floor and everyone in the arena is screaming at you. How would you go about responding? How are you going to get through that moment? And the answer is you can't. You cannot. You just simply cannot respond to that many people that quickly and give everybody what they want. And so although we were all very customer service oriented, and one of the best experiences or part of the experience has been serving, we had to realize what we had to put in place first, which is the structure, which is carrying out what we had to do so that we could serve people and not responding to every single person who was calling us and trying to get through the doors. And at one point it did become necessary to temporarily kind of distance ourselves so that we could do our work, because we were being deluged nonstop 24/7 for months on end. So I think one of the turning points for us in our ability to succeed was that we did find ways to distance and accomplish what we needed to accomplish so we could get it out there. And come January, that proved very effective because we were one of the first counties in the state of Illinois to open up a mass vaccination site, to the point where we had many individuals coming from Cook County and surrounding counties because they couldn't get the vaccine and they were hearing that we were the ones that were open. All right, so getting into December, at the same time, we were planning for the initial shipment. So Pfizer was a very complicated vaccine from the beginning. It's become less technical or less challenging over the last year, but with the cold freezer requirements and the temperature requirements of that vaccine, it had to be delivered in certain periods of time. So went into daily operational meetings with the Illinois Department of Public Health and our staff and Laura and Teresa and Katie and many to really talk through with the hospitals how this was going to look. And it wasn't just once. This was the first shipment that came December 16th, that involved a great effort between us and the Office of Emergency Management, and the Kane County Sheriff's Office was integral on the delivery of that vaccine, which all these vaccines were delivered on time and within the required temperature requirements so that it could be safely administered. And what a day that was. So emotional for so many people as we were bringing this vaccine to the doorsteps or to the loading docks of these hospitals. And you can see Madam Chair and a few other board members there in the pictures on the screen. We had nurses crying. People were crying as this vaccine was coming. And so there's been so much, especially over the last 2 years, on emotions about the vaccine. But I'm reminded of that moment when the individuals that this meant the most to, those who had been suffering loss daily through the patients that they were treating, through their family members, and through the hours that they were committing, this meant the world to them. So to be able to bring this to them and see that reaction was a reminder of why we do what we do and how incredibly important it was. And it was a tremendous day, a tremendous effort by many, and we'll never forget that. But those are just some pictures of that day and the delivery. And there's a pharmacist there going through and making sure that he's got all the vials he needs. So I'm going to move on. We also, in this same time, we were, of course, continuing to plan for the initiation of our mass vaccination site. So we had secured Kane County Fairgrounds, which was another tremendous partner. They really came in and helped us pretty significantly by offering their facility at an incredibly low cost, practically nothing. They lost money on that deal. And it really served a great purpose, and they helped us out significantly while we were there. It was a time to transition when we did. But for the time being, while we had to get this vaccine out to the 1A groups, the initial priority groups, it really came in handy. And you know what? A lot of people had great experiences there. And we heard tremendous comments from the community of how well organized and just what the facility did for the flow and what they were able to experience there. All right, moving on to January. Katie?
Thank you. So now we're in January of 2021. Mass vaccination has officially begun in Kane County. On January 7th, we opened our first mass vaccination clinic at the Kane County Fairgrounds to serve our phase 1A healthcare providers. At this point, the prioritization groups had been identified. They are listed there below under population served. So in phase 1A, we saw our healthcare personnel, we saw our congregate care staff, we saw our first responders, our public works staff, and our education sector staff. So 1A through 1B is what was served at the Kane County Fairgrounds. But at the same time, so we started mass vaccination. The fairgrounds ran all the way through into mid-March. We held clinics at the site. We had 4,998 doses administered in the month of January. But I would like to point out the reason we had 4,998 doses administered in the month of January was because the vaccine was so limited at this point. We were still under allocation. So how it would work is the state would receive their allocation, and then ours was dependent upon the population that our county made up of the state. So that's how they did our vaccine allocation. So we had what we had, and that's what we worked with. And at the same time, the Kane County Health Department was distributing the vaccine to our other healthcare providers. Direct ship had not come on board yet. So the vaccine would come to us. And as we were running mass vaccination clinics, we also had to be responsible for getting this vaccine to the other healthcare facilities so that they could vaccinate simultaneously and get more shots and more arms as quick as possible throughout the county. I would just like to call attention to the agencies initially involved in the fairgrounds. So we had our Medical Reserve Corps, which were some of our primary staffing of the clinic. The Medical Reserve Corps is a completely volunteer organization made up of both clinical and non-clinical staff. They staffed all positions at the fairgrounds. Our King County Sheriff's Office not only provided EMS services, but also security of the site and of the vaccine. The Kane County Office of Emergency Management also provided security and traffic control of the site. information technology. Thank you so much for getting us on board there and hooked up with all of our tech. And our municipal fire departments. Our municipal fire departments were amazing partners at this stage. They really were. Not only did they come out to provide EMS, they provided ambulances, and they provided vaccinators. And they loved doing it. If anybody saw the fairgrounds at this point, it was a contest between them who could vaccinate the most people. And you're talking about paramedics and EMTs who just worked a 24-hour shift, got off shift, and then came to vaccinate for us for another 9 hours. So they were incredible partners, as were our education facilities, Aurora University, Elgin Community College, Waubonsie Community College, NIU gave us their nursing students. Waubonsie gave us their HIT students to come and fill non-clinical roles for us, and Amita Health were phenomenal partners in sending us additional nurses to help vaccinate. So we could not have enough hands at this point.
One of the main benefits of this site was to have the layout, which was really important when we were devising the site. We used universal flow, meaning you come in one door, you go out another. If you think of it back at this time in January, we didn't see people too much. We'd spent that holiday season right before then home, not visiting with family. This was the first time in many, many months since March that people were gathering with that many people around them. So it was extremely important, because the vaccine was very new out, that no one stayed at any one spot during the transfer process going through of the clinic more than 15 minutes within 6 feet. So we constantly kept the flow going. So that was a safety measure for both our staff, but also for those coming to the site, but also for the flow to get them in and out in 30 minutes, so that our turnover in our parking lot did not delay anything either. So the idea was to get them in and out in 30 minutes, and that includes that 15-minute waiting time with it. Skill sets, as Katie already has alluded to, we had anywhere from paramedics to nursing students to nurses coming in to administer. We've also had physicians, podiatrists. So skill set varied significantly. Training was extremely important, also validating competency. And one of the pictures up there, the top left or top right, is our morning huddle. We did a huddle before each shift and went through what needed to be done, any updates, what we'd learned from previous clinics, and shared that on out to the team and made sure safety was there. This was just a fun clinic. It was just fun to be around people. People were happy to be here. It was exciting. We talked about maintaining that cold chain. So just a reminder what that cold chain is. When a vaccine is produced at the facility, the manufacturer, it is kept and stored at a certain temperature range. It's usually within about 5-10 degrees within that range with it, whether it be a frozen or a refrigerated range. That temperature has to be maintained through the transport to wherever it's being delivered to, through all the way until it's administered into someone's arm. And so we have to follow that. We have to record that temperature either manually every 15 minutes or getting those digital data loggers, which were extremely important, that continuously monitored it. And then we download those reports. We have to send every one of those reports to the state of Illinois for our iCare to maintain our vaccine competency and being able to still provide that. So. And in February, boy, we started expanding. Now we got the joy of finding out what first dose, second dose was. They sent different lot numbers for those, and we had to keep track of those. So the challenges continued on with that. We expanded to holding clinics at the Kane County Sheriff's Office with our EMS team that we expanded. It was a very innovative way of expanding out our services and being able to reach out to our first responders, our sheriff department, and those out in the sheriff's clinics, redistributing to the partners. So now we had first doses, second doses that we had to make sure that were delivered. These were delivered or picked up at the health department from all of our hospitals, our federal qualified health centers, certain pharmacies in the county, and some doctor's office that would come and pick up their vaccines from us. As Katie had mentioned earlier, we were the only place that was receiving them. They could not get them directly shipped to them directly, so they had to come through us. So we had to maintain that. And again, the Doses this month were over 14,000, but it was only limited because the supply was limited at this time.
Additionally, in February of 2021, we launched EmTrack using Juvari's system, which is a system that IDPH procured and allowed counties to use free of charge. So what that was our online registration system. Prior to this, throughout the whole month of January, we did utilize online registration for the fairgrounds clinics, but we went through Sign Up Genius. And while it worked, this was better. So what this meant was individuals would go online, they would register for their appointment, they would fill in all of their information, they would receive a QR code in case any of you are familiar with it. They would bring that QR code to our site. We would scan it upon entry and that would check them into the site. That let us know how many people were on site at one time. We could track how long it took for an individual to move through the site. And then also, once they had received that vaccine, we scanned that QR code again and it automatically uploaded that patient information to iCares, which is the state's registration system for vaccinations. And it took a load off of our data entry team. Prior to this, our data entry team took every single consent form for every single individual who was vaccinated and manually entered it into that state system. And that had to be done within 24 hours of receiving the vaccine. So this was a massive undertaking for data entry. So this did help alleviate.
So one of the biggest wins, if you go back real quick, I'm going to make this very brief. So one of the biggest wins, I think, of the entire process, and one of the best outcomes for us was around this timeline when IDPH, CDC and IDPH finally allowed for the 65 plus population and the immunocompromised to begin receive the vaccine. So of course, the emphasis was on 1A and priority groups because people that take care of us need this vaccine, and that was very important. But wow. We know that there were some people in this risk category that were waiting for it and that needed it. And for us, this was when it's between the day that the vaccine first came in and this point, this was that second day about this timeline where this became very, very meaningful for us. And I want to just acknowledge Michael Isaacson and the work that he did coordinating with these associations, our Senior Service Association, Gale Board and Library and Age Guide, because he was on the phone with them night and day, going back and forth, and they were assisting us in getting these individuals registered because, of course, it was a major hurdle for a lot of individuals to use the online management system. So it wasn't like we just put that out there and said, you're on your own. We made sure that we were assisting those who needed assistance in every way that we could. And Michael Isaacson was a major part of that.
Our Elgin Community College mass vaccination clinic was one of the first times we looked at setting up a mobility impaired fast track. So this allowed people that were having difficulty ambulating or who were in wheelchairs to be able to go and fast track through, not have to go through all the lines. So we would actually take them to a special table and allow them to check in there, receive their vaccine and check out at that time too. And then we also put them in a special area close to the exit for their 15-minute wait time. And this really helped them with being able to tolerate the procedure, the vaccine, and also be able to quickly do it without a lot of physical exertion on their part.
And then into March, we mobilized supplies and set up for multiple sites. Continued to be challenging because in March, we were going between, we finished up at the Elgin Community College site, we were back at the King County Fairgrounds, we were back at Mooseheart, and we had this mobile group of this huge effort to move things. And to be able to sustain that, it was becoming more and more challenging as we knew the limitations were going to be opened up as more groups were going to be coming in, and we still had lots and lots of people yet to vaccinate. So that was becoming a reality during this time. The volumes increased significantly during this month, You'll notice that the throughput was 25,000 during this month, but the throughput for a total of 1,857 vaccines administered at that point was our highest one-day amount we had ever given. And that was before the National Guard came in. That was just with our volunteers and just with the Health Department, the MRC. So, and that amount still ranks it as our highest day ever. Within highest one-day volume. Go ahead, Aaron. These are pictures of the Mooseheart site. Fantastic place there and a great coordination, collaboration with that group too.
Yeah, like Laura might have said, this was a pretty pivotal moment for us too. Of course, this was at the same time as we were prepping the KVAX hub for activation, actually the very following Monday. I believe this was on a Friday, so are very close together. But this site was a wonderful site. It was great to work with the individuals at Mooseheart and the staff over at Mooseheart. They were very caring for us. And we hit our highest peak throughput here. I think Laura mentioned this. So it was almost a test to see if we were ready to get to KVH, because we knew we were about to ramp up the volume as soon as the vaccine became available to us, which of course at this point, the National Guard was coming in at this time, and we were having a lot of discussions with the Kane County Board's office, Madam Chair, Jarrett Sanchez, Kathy, and many from the governor's office on how we were going to become an Illinois site. So until this point, we were 4 Kane County residents, and the vaccine was distributed to different counties based on their population size. So it really wasn't part of the plan to administer it to individuals outside of your county, because again, it was all a portion based off of population size. And we weren't getting the most. Cook County was getting more than us, DuPage was getting more than us, et cetera. When we got to this point, essentially we realized that we had a really good model, and individuals from the National Guard and the state and teams were actually using us as an example county to come and kind of look at our model and then try to replicate that. So they would come meet with us, look at our site, look at the way that we had staffing set up, the way that we were using the online management system, and they would go and replicate that at other arenas like the DeKalb location, for example, and the Cook County locations. And we decided we could become an Illinois vaccine site. And so, of course, Madam Chair was pivotal in that. And what that really meant was we were going to receive staffing from the National Guard more so than some other sites. And we were going to receive more temporary staffing, on-call nurses and LPNs from the state of Illinois, contractor nursing. But we were also going to receive any vaccine that wasn't used in other locations. So it's not like there was an influx of vaccine that was sitting for Illinois mass vaccination sites, but what they would do is say a site in Southern Illinois was no longer in need of their vaccine. As soon as they could, ship it up to us, and we would receive that vaccine, because now we were seeing residents from around Northern Illinois. Now, of course, we continue to serve about 75% of Kane County residents, or 75% of the individuals coming through were Kane County. And then, surrounding counties after that. So it really, in the end, it worked out very, very well that we were able to receive those resources and that additional vaccine. But this is about that time that it changed. And just to memorialize these great events, these are some pictures taken from the opening ceremony and those involved at the site. Again, so many partners involved. And a lot of people working on this, many Kane County departments, information technology, I know has been mentioned, building management, procurement. People sat around the table and said, whatever it takes, whatever you need. And for me, that was one of the most rewarding parts of this project, is just to be able to work with people who were dedicated to the mission, would put in however much time and effort it took to get the job done as quickly as possible. And it was stressful, but it was necessary, and people came together and were their best. Another here. So another little quick thing to point out too is, of course, while we were still working on our mass vaccination side, we were still coordinating the distribution of vaccine to all of our healthcare agencies. So our ICS leadership team, being Michael, Uche, myself, Kathy, and Laura, would meet every single morning at 8 a.m., rain or shine, no matter what day, no matter what we had going on that day. And we would continuously assess where our vaccine was, how much was coming in that week, how much we had on hand, the expiration on it, any technical details that went on it went into that, and then who needed it. So who was getting theirs out fastest. So we wanted to, of course, work with our partners such as VNA and our hospitals, all 5 hospitals. We coordinated the distribution of vaccine to them. They literally came to us and picked it up, or we took it to them. All of our medical providers, meaning independent practices that became COVID-19 providers, which we had to help them get enrolled into the process and then coordinate their distribution of vaccine. So we were taking care of that every single day while all of these things were going on. So again, Uche pivotal in this, Kathy led this, Michael, Laura, just never ending work, but a lot of people got vaccine faster because of the work that they were doing.
Well, we got through March, right? Got that CaneVax up and started. So why not do a couple more spots? So we set up in Aurora on April 2nd, and 5 days later, we opened up Elgin. So phenomenal work and getting 3 sites now, expanding out with additional National Guard coming in, additional agency nurses coming in that had varying levels of skills that needed to be trained, and then also validating on competency because we wanted to make sure we were safely administering these all the way on through. This was a logistics, expanded on out, supported this with supplies, consents, EUAs, everything that was updated, and getting those moved to the right places at the right time, along with the staff that needed to work with nurses from all over the country that came in to support this and that were brought in, along with our National Guard support. I'm going to the next one. And just a great collaboration. At this time, starting at the end of April into March, April, and May, we were doing some mobile clinics starting out at that point with them, even before the county or the state even kind of started with that whole process. We were doing some trailer parks down in Montgomery. We were doing senior services out in Aurora. So areas that we were moving on out. And then as we got further into May, Uche was wonderful at collaborating and coordinating with IDPH sites, with our sites, and making sure that we were truly hitting the health equity gaps that we were finding and starting to see with the vaccine administrations going on in our county, and making sure all those areas are being covered. We were up in Carpentersville. We were down throughout the entire county with both sites. And working with our partners to make sure anything that was not covered was also covered with our coordination. So thank you, Uche, for all your work on that.
With the approval of the CDC and the IDPH, we began giving pediatric doses, which was a very exciting time for us. These are children 5 to 11 years old. So we wanted to make this a very easy vaccine for these children. So we made a special area that was child-oriented. We decorated it with different things for them to look at. We had some stuffed animals for in case they needed to hold something while they were getting their vaccine. There were tents available for special needs children or for children that had a lot of anxiety, so they could be separated and calm down. The EMS helped a lot there also with talking to the kids and spending some time with them if they needed in the tents, and then giving them their vaccine. We had movies going so that the kids prior to getting their vaccine and after getting their vaccine had something to look at. We also had, the nurses actually went out to get the children, asked the parents if they had any questions, instead of just shuffling the children in to get their vaccine. So this helped with a lot of anxiety with the children. We also had, we gave away when they succeeded in getting their vaccine, which I'd say 99.9% did. We gave them a coloring book with some crayons. We had some donated books, children's books that we let them pick from. We had the YMCA, and I'm sorry, I forget the other group, but they also had new books and some toys and things that the children could pick. And we just made this a very easy vaccine for them. Parents were very happy with our pediatric section. and we kept them entirely in their own area.
Okay, as Teresa briefly mentioned EMS, we just want to send out a huge appreciation to our EMS. So for all of our mass vaccination sites, whether it was a community clinic or one of our static sites, we had EMS on site, generally 2, sometimes 4, it depended on the throughput of the day. Our EMS gave over 14,000 hours towards the response across all 3 of our static sites. That includes Carpentersville, that includes the fairgrounds, any site that we were at, we had them. Largely, it was provided by the King County Sheriff's Office, and it was all coordinated by Lieutenant Kevin Tyndall with the King County Sheriff's Office. And we truly would not have been able to do it without them. And as Teresa mentioned, if your family needed it, they gave it to you. So anybody who was highly immunocompromised, right? They felt uncomfortable walking into a massive vaccination site where we were packing 4,000 people a day. So they would pull their car up and they would ask if EMS would be willing to come out and provide the vaccine in the car, and they did. Anybody with a special needs child who would not react well to walking into a large site around that many people, they went outside and provided that vaccine. They did everything in their power to make it a comfortable experience for everybody. If you were just nervous around needles, they would let you come and lay in a tent to receive your vaccine rather than sit among the masses in the middle of the clinic. They truly were wonderful.
And if you remember, our initial plan was to do the drive-through, and we very quickly realized that that was not going to be a safe mechanism to do that. With this vaccine, as we were seeing some of the reactions and some of the needs to be monitored more closely, and the support from the EMS was crucial to being able to have these continuing on with that.
Absolutely. As was the support from our emergency management agencies. Our emergency management for Batavia and for the fairgrounds, Mooseheart, the clinics, all of the clinics except for Elgin and Aurora was provided by the King County Sheriff's Office of Emergency Management, which was coordinated by their director, Sean Madison. And I just wanted to take everybody back to the fairgrounds for a minute, back to January. The vaccine first arrived, and we had masses of people who wanted it, who couldn't get an appointment, who weren't eligible yet. And I mean people to the point where when we were serving phase 1A, people would show up in scrubs hoping that that was enough to get them in the door. They would go out and buy scrubs and show up as healthcare providers to get it. And obviously, when we had to turn these individuals away because they did not yet meet the priority groups, I'm sure everybody can imagine and everybody remembers the reaction of somebody who just wanted this vaccine, but we couldn't give it yet. Our Office of Emergency Management, all of our emergency management partners, they're the ones who took the brunt of this. Every complaint, every angry individual, they're the ones who dealt with it. 99% of the time, it never reached us in the clinic because it was handled outside. So we really can't say thank you enough to them. But at the same time, they got all of the happy smiles as well. So they got to hear the stories of how much this meant to individuals coming to receive this vaccine. So we just want to say a thank you to all of our emergency management partners as well.
And just in summary and closing here, over the past 15 months, the county health departments provided COVID vaccinations to residents in not only Kane County, but Illinois, our country, and nearly every continent on earth have been part of our vaccination clinic. We could not have done this without the great, and we're very grateful for the tremendous support and the resources both the Public Health Committee has provided and the county board has provided in supporting this. And also to our staff that have been tremendous at just really helping throughout this and making sure everything was completed in a very safe and quick way as possible as we best could.
And like I always do, I'm going to make a special shout out for the Medical Reserve Corps. Those are over 8,000 true volunteer hours not compensated for. And they provided, along with the Office of Emergency Management and Sheriff's Office, provided what came to be why it was so successful, because of the customer service that was really provided to the individuals coming to see us. People were taken care of and they treated people like family. And so if you sat down with the Medical Reserve Corps nurse, you felt comfortable with it, and the same as being greeted by the individuals from these other agencies. The spirit that was maintained throughout these just made it worth it. But thank you to our Medical Reserve Corps as well as the other partners. And small, it's a lot to read. I think there's more plans for acknowledging all of the wonderful support that we received, but we had a lot. We had a lot of it. And so we just wanted to at least list out their agency names here and acknowledge them. So this is over 50 agencies were involved in this. So truly a whole community effort. So thank you all. Thank you for having us come to present this to you and listen to this today and giving us the time. And thank you for your support as well. If we haven't said that enough, we sincerely appreciate it. And thank you, Kathy, again for the opportunity and inviting us here today.
All right.
And I will, you know what, I'll throw it out. I don't know if we have time for it or not, but if there were any other questions, we did want to make sure we entertained any of that, if there's time.
Okay, if there is questions, if you could just throw them in the chat room and we'll make sure they get answered because we are definitely running very far behind, but thank you so much for the presentation. I know myself, I did not realize everything that went into this. You know, I remember sitting in this seat in the very beginning, hearing about, oh yeah, there's this coronavirus over in China, and we had no idea if it was or wasn't going to really affect us. And now here we are today. You guys have all done an amazing job. I'm just grateful for everything. Thank you very much for the presentation.
Awesome. Okay, so we'll go on to the next agenda item. So we, as promised, so we had attached a quarterly strategic plan summary. And so that was available. And so if anyone has any questions, we'd be happy to answer that at this point.
Okay, again, since we're running so late, I don't see any questions. So if you do have anything, just throw them in the chat room or send them directly to either Jared or Kathy, and love to answer them. Thank you.
All right, excellent. And next we have a very brief COVID-19 update by Ms. Uche Anwuta, our Director of Health Protection.
Good morning. This will be very brief. Let's get this. Okay. So as everybody has heard, we've pivoted from how we classify the transmission to community level transmission. It used to be community transmission, and now it's community level. So basically, I'm not going to go through all this, but the fact that the number of cases have reduced, and for that reason, we're more interested now as we're approaching the endemicity. We're more interested in the impact on the hospitals, the severity of the disease, and those who end up in the hospital, impacting the hospital system. So that's why we pivoted to the new community level. Basically, just to cut it short, is if we're fewer than 200 cases per 100,000 in the last 17 days, if we have a case rate less than 10 per 100,000, and we have less than 10% of our inpatient beds occupied by COVID-19, then we're in the low capacity. And guess what? King County is low community level. That's why we don't need masks anymore. I'm sure Ms. Lewis is happy about that, and so am I. Yeah, so you can see with our numbers, we're less than 10% bed utilization, less than 10% admissions, and our cases are less than 200 per 100,000. So I usually give this, the variance, when I presented last month, I told you that we didn't have any BA2. Well, right now we do. So I broke down Omicron, the BA1 and BA1.1, and then separated the BA2, which is considered Omicron, but just to show you that we have a few cases, and we're getting more of those BA2 cases as we speak. This is our vaccination for King County. Total 66.6% of our total population vaccinated, and 71% of 5+ age vaccinated. So it's trying to get it done in 5 minutes or less. Everybody is still eligible to vaccinate, and we still encourage vaccination so that we don't have to go back to wearing those masks. So please still encourage people to get vaccinated and get boosted. Happy St. Patrick's Day.
Thank you. I think the last thing that she said was super important to remember. We can't let up now. We still have to get vaccinations. We need to get the boosters. If you're in public places and you feel like wearing your mask, wear it. You're certainly it's not gonna hurt anything to wear the mask. And back to the good old fashioned hand washing and all those things that we kept talking about at the beginning, we still need to be vigilant with. Thank you.
Bates, please.
Madam Bates, good morning.
Bates, please. Hi. Are we recommending a fourth shot?
That's just coming up.
Yeah, this is Laura Barrett. At this time, it has not been approved or through the CDC, so we're waiting for that approval to come through. There has been research showing that there's some positives for that, for those that are 65 and older, and that may be something that we'll be seeing coming down in the next few weeks, but we have not received any word on that yet.
Okay, thank you.
Madam Chairman.
Yes,
Mr.
Mr. Byrne.
The question I'd like to ask is how do you feel about the continuation, or is it time to look at ending the Caneback site in Batavia? Anybody want to jump on that one?
So,
See the numbers going down
mhm.
in the number of people that are being getting immunization there. And my thought is that it can be handled by other sites, and that by going out into the community and putting on individual clinics, and by advertising that, I think we would get much more effective utilization of that.
Yes. So Kathy Bosser, interim executive director. So we will definitely have a follow-up meeting when Jarrett returns and with Madam Chair and discuss those certainly. And, we will do, whatever the board desires. So.
Okay, if there's no other questions, we do have a resolution this morning. Okay, resolution is the authorization acceptance of the fiscal year 22 NACCHO MRC RISE grant agreement. I need a motion and a second, and then we can discuss. That would be Tepe and Strathman. All right, do you want to discuss this?
Good money.
Sure. So this will be something to enhance our MRC program. And just real quickly, one of the important things that we have is, as you know, we have medical staff, and they require continuing education, and we'd like to be able to offer continuing education credits for them, and there's expenses to that, of course. So we feel it's very important that we continue. The MRC was very strong for us, and we want to continue to do what we can to enhance the MRC program. So this would give us that opportunity.
And a good job in continuing to look for funding sources. Thank you.
Oh, great. Any other questions before we call roll? Okay, seeing none, roll call, please.
Shepro? Strathman?
Strathman, yes.
Tepe?
Tepe, yes.
Silva,
Silva, yes.
Lewis,
Lewis, yes.
it passes.
Okay. All right. If there's nothing else for the health area, let's move on to animal control. And Brett is somewhere.
I'm still
It looks
here.
like- Oh, you are here. Okay. I thought you were on a cruise somewhere.
No, this next month I will not be present. I'm taking
Okay.
my first vacation in 3.5 years, so I'm very excited. I will be going.
And how dare you?
The only thing I have this month is that our first vaccine clinic will be April 23rd. It's still going to be drive-through style to ensure that we still keep everybody safe. We'll be assessing that moving forward if we're going to bring them back in or if we're going to keep people through the drive-through style because actually it is very efficient and it moves animals through pretty quickly. Other than that, I don't have much to present this month, but I'm always available for questions, answers, anything I can do for anybody.
Okay, awesome. Any questions for animal control?
Madam Chair Gums.
Yes, Michelle, good morning.
Hi there. Just a really quick question for Brett. I noted that we're in need of some dog food there. Is there anything that we can do to help with that effort?
Yeah, we put out a call to our online community to if anybody's able to donate closed bags of food. We don't take open. That's for the safety of animals we bring in outside. Anybody that's willing to donate some food, we're always appreciative of that. Our biggest need right now is dry dog food. The main brand we feed here is Purina, but of course, we're willing to accept anything that this kind, wonderful community is able to donate to us.
Excellent. Thank you for sharing.
Thank you.
Yeah, thank you for sharing. I assume you'll also take cash for that.
Of course. Donations are always accepted.
Yes.
Madam Chair, Shepro.
Go ahead. Good morning,
Yeah,
Ken.
can I be recorded as yes on that last roll call?
Absolutely.
Thank you.
Do you want to adopt a dog?
I have cats.
Okay. All right. Anybody else? Okay. Moving along then. Thank you very much, Brett. I have no old business. Need a motion to place the reports on file?
Tepe moves for unanimous consent to place reports on file.
Okay. Strathman seconds.
No
Any
objection
objections?
to the,
Okay, then the reports are on file. No executive session, no new business, no public comments. But before we adjourn, I do have one quick thing. Last month, a couple of us asked for a demonstration of the iris system, and there will be a video coming out on that will be available to us. They just got a little behind because, I don't know, they do other things at the health department. So, but it will be forthcoming. I also had a chance to listen to the youth forum last month and listen to the mental health concerns of our high school students. And it scared me a little bit because there's so much anxiety and depression and a lot of it's like in family members and then it translates to these students in school. And we always, tend to think of high school kids as carefree, but it's really not that way. So I'm hoping after COVID, we can really start getting back and focusing on our mental health needs in our community. So just my opinion. I guess we need Mr. Kenyon to speak up.
In honor of Mr. Kenyon, Mr. Tepe moves for adjournment.
I'm not a member.
And Strathman seconds.
Okay, thank you. In honor of Mr. Kenyon. All in favor?
Aye.